I teach speaking engagements that are usually a lot longer than 45 minutes. I usually teach 1 and 2 day full courses. And I've always realized that it takes me about an hour to warm up, which is perfect for today. Right about at the end, I'll get warmed up. So what my company represents and what I represent is really the physical exercise arm of what a lot of these physicians talk about. And I just want a quick hand, anyone in the room that desires to become a functional integrative physician of some sort, raise your hand, really tall. So that's so exciting to me because I feel like now I'm speaking to the future and what's going to happen here. But everything that both James and Eric said speaks to the heart of what I do. And so what I do is I represent a group of clinicians that really try and be the ground roots, army, infantry trying to affect the world. So I'm a physical therapist. I teach other clinicians. Last year, 2019, I think we affected about 3,000 people in the Sacramento region, from Davis to El Dorado Hills to Roseville. That coupled to about 25,000 visits of physical therapy. But what's cool about this type of physical therapy is we are in gyms. So speaking to what James talked about scalability, we are in gyms that have classes. So we help people move better so that they can do safe exercise in a community that reaches quite a few goals of both scalability and affordability, and actually impacting and empowering their health. They monitor their heart rate. They look at their obesity measures. They look at their nutrition in the morning, or if they're doing any IF work with the doc, intermittent fasting work with the doc. They work with me on how stable they are or how well they control their body and their movement. And it becomes a very real-world solution for overall total body health. So it's the physical arm of what they represent. Now, in full transparency, what I tried to do today is I put a 2-day course that we give to trainers and clinicians, and chiropractors and massage therapists. I put a 2-day course into a 45-minute talk. So I chopped a lot of my slides. I got a little bit beefy on research, which I don't want to dive into too much. Just want to really kind of show that we have some nice key points of research that strengthen my resolve of what we do, and more or less give you a synopsis of what physical therapists do in terms of functional integrative health. It's much less about knee pain and more about improving someone's life so that they can walk or they can do a safe HIIT class, and how well are they monitoring their nutritional goals and their performance goals. So let's start. So the course that I give, it's called The Bulletproof Body, and it speaks exactly what Eric was talking about resiliency. And we can't predict what life is going to happen to us, but we know that it tries to knock us down. And our ability to get back up is life. And so the resiliency of our cells, resiliency of our body is everything. So that's why we labeled it a bulletproof body. And the cool thing about this talk is it's not just for your upcoming patients in your career or the current patients of these doctors here, but it also applies to you. And that's the best part. And so when we talk, it is about reading and listening, looking at research, looking at science. But the critical part, life is movement. Movement is life. Function is our ability of doing something with our mind, with our body, with our soul, with our loved ones, with our friends, or with the community. And it means movement, and it means action. That is function. Function is doing something that's important to us. So it's critical that we do move. And I choose this image because I teach the trainers, and this is, this speaks what they like to see. But it's really about owning different buckets of the movement equation, from agility to resiliency to flexibility. And I love how Eric presented strength training and aerobic health and the ability of touching your toes. It's not one's more important than the other, it's all important. And when we educate to our clients, our patients, we first start with this little pyramid. And it's just a nice visual that tells a story. Your lifestyle factors matter. They matter a ton. And a lot of people will come in and say they're a little overweight and they've got some valgus collapse in the knee, and they're kind of trying to figure out how they can do more running to influence their life. And so they're asking me about what type of marathon shoe should they pick for their upcoming 6-month training block. That's the tip of this pyramid. And I ask them, what'd you have for breakfast today? And then they say a sausage burrito. Like, we're focusing on the wrong things here, okay? So let's get the sleep, nutrition, stress dialed in. We can talk about how well you move and how well you control your body so your knee's a lot healthier. That way you won't grind on your knee, create more of an arthritic joint, hurt, and stop training and live an unhealthy life. Let's stop that cycle. and improve how you move. So we use this pyramid so that we draw people's focus in the right area. And if we want to get a little bit more meaty into our evaluations or a deeper connection with our patients, we talk about those stresses of relationship health, their belief and culture, their anxiety and fears, and we get deeper into understanding them as a person and trying to impact them in a positive way. And not ever pretending, me as a physical therapist, to be a nutritionist by trade, but I'm going to support what the doctor says. I'm going to support what they're reading. I'm going to have some accountability for what that person is doing, because I become their coach, at least for that moment in time. And my clinic and the clinicians behind me, we do this with the doctors here. So we treat Dr. Burke's patients, and we know what she says, and she actually gives them a little report, and she talks about what they need to be doing, and then we present ourselves as an accountability coach for their lifestyle factors, and I become a very specific, detailed coach on how well they move so that they're in less pain and they can accomplish their goals. There's a lot of components to health, and I love low tech. I support high tech. I was a part of Dr. Hawkins' research team at UC Davis 10 years ago, and I love where research and science is going, but I love bringing it down to something really, really simple. I think it is fun to talk about some really interesting science that's happening as Eric was presenting, but I love talking about people's heart rate. Something simple, everyone's watch does it these days, and I ask, what's your resting heart rate? Something so simple, it's like, well, if we were talking about it 40 years ago, we shouldn't be talking about it now, and I couldn't disagree more. Let's bring it super low tech and make it real so that people understand their limiting factor. I have a young kid right now. He's a miracle kid. About 8 weeks ago, he's a college student, freshman in Santa Clara. He was skateboarding across a major street, and a truck hit him about 45 miles an hour. He somehow survived. He flew about 300 feet, and he doesn't mind me sharing this story. I kind of asked him if I could share it today. But he somehow survived after a 2-week coma. He broke several bones in his body, had about 6 surgeries. He first came to me right after Christmas. They were so excited about starting rehab. He came in a wheelchair. He was freshly operated on 4 different areas of his body, and his inferior vena cava had a deep repair, so his whole cardiovascular system was severely compromised. So his resting heart rate was 115. He couldn't stand up, and everything more or less didn't work, and he had this kind of floppy body. 4 weeks later, with very, very controlled training, he's standing, walking around, no problem. He can balance on one leg, on both legs. They were both operated on in different ways. His resting heart rate's in the 60s. Every single time I saw him, I'd always ask, what's your heart rate? What's your heart rate? What's your heart rate? Every single training stress, I'd have him ramp up slowly to about 160, and then he would know to sit down until it got back into the 130s. Training for him involved this slow dance of his heart rate throughout the hour to 2-hour training session. These days, so it's only been a month of training, he comes in and trains. He'll get his heart rate regularly up, regularly down for about 2 hours. He'll focus on strength, flexibility, dynamic control, balance, but recognizing his limiting factor. It's definitely his cardiovascular system. So a big part of understanding the physical arm of the components that was just talked about. The physical arm, we can think of it as exercise, but it's really how well we move and how well our body controls that movement and recovers from that movement is, we can look really clearly just at heart rate. So the heart rate at rest is a big deal. We start getting really fancy with people's training regimens and understanding how high can your heart rate get, otherwise known as heart rate reserve. And then we can look more detailed as to how well they recover. But definitely know your typical wearable or anyone's app on their phone, they can get real on how healthy that they are just by looking at their heart rate. And these days, heart rate variance or heart rate variability is starting to become a pretty hot topic. Usually if Apple gets it, then within a few years, everyone's going to know about it. But we're maybe even able to tease out how well you can recover from stress by looking at HRV. So there's a lot coming, and I think it's fun and important for both functional integrative specialists as well as allied clinicians to be very well schooled on not only low tech looking at heart rate, but also on the higher tech realm of looking at HRV. I love sharing this to clinicians. I love sharing this with trainers. And I've asked this question to many people throughout the country when I teach little events like this. And I ask, how many beats are in a life? How many beats? And no one answers it correctly because you'd have to be a really interesting nerd to know this right off the top of your head. But humans live about 3 billion beats. We are weird from a mammalian standpoint. We are the odd ducks. Most mammals live about 1 billion beats. That's the turtle, that's the big cat, that's the dog. They live about 1 billion beats. So from us, about 2.7 to 3 billion, it's a game of efficiency. So right now, you should all be wondering, what's your resting heart rate? And if you have a watch, go and check it out. I'd be curious. And if you guys are in the lower 70s, and the textbook says, well, if you're 60 to 80, you're somewhat normal. If you're 80, you're not normal. You're kind of sick. You've got systemic inflammation. You're unhealthy. And it's sad that it says 60 to 80, because most healthy people that I work with are in the 40s and 50s. So we should be changing our medical profile and looking at what's the best optimal performance that the heart can do to understand how well we can recover and regenerate. And so looking at, again, low-tech stuff like heart rate is a big deal. And it's also a predictor of longevity, an independent predictor outside of your fitness level. And again, to speaking what Eric talked about, we have DNA influences, but that expression of our DNA is built off of lifestyle. So maybe your parents or your grandparents did live to 110, and you maybe have that potential. Or maybe you have some chronic illness in your history, and your dad died at a heart attack at 55, and your grandpa died at a heart attack prior to that. And maybe your DNA is not set up for well success, but the expression of those genes is really built off of your lifestyle changes, which is why we're even here talking about lifestyle. But this is looking at heart rate reserve. So if I take someone that's not good at exercise, and they're kind of, I want to get healthier. Well, I want to see, well, what's your resting heart rate? Okay, say it's in the high 70s. Let's do a little treadmill climb for 20 minutes. Okay, you're out of breath. It's pretty hard. What's your heart rate? Well, it's only 122. Okay, you have a very stunted heart rate response, and it's chronically high. We have to be pretty safe with you. You can't just join a HIIT class and have success. You will hurt. So our ability of doing safe, prudent, and appropriate exercise is completely customizable. We have to know who we're dealing with, both at a heart rate understanding and of a movement understanding, which is what we're going to get a little deeper into. Okay, so I present this again in our talks to understand the role of exercise in our life. At the bottom, you'll see reduce, repair, regenerate, and recover. So the reduction area. So we know that exercise reduces inflammation, but it has to be safe. If you have knee pain and say you have a little bit of arthritis and you start doing a whole bunch of jumping jacks, that exercise is not going to reduce inflammation in your body. So it has to be safe and appropriate. If it's safe and appropriate, it can. We know that delayed wound healing can come back to mitochondrial density, can come back to aerobic health. Consequently, if we improve exercises, if we improve mitochondrial density in that tissue, we can improve wound healing with exercise. Safe exercise, of course. This is deeper stuff on mitochondria, and I love it if every one of you can become mitochondrial experts, much more than myself. I'm just simply looking at how can I real world change someone's mitochondrial density in a safe way and showing to people how to do that. I'll present that in a second here. But we know that mitochondrial density affects the muscle cell regeneration. Now, what I didn't really quite understand when I was going through my academic time was that I understood the mitochondrial health component, but I didn't realize you can make such an immediate change quite rapidly. One exercise session, you're changing it immediately. And that was kind of a new thought, that it wasn't just you have to do exercise for 3 months or 6 months or a year to have some amazing benefits. Let's start today. And you do it today and it has amazing change. Within here, this research looks at 24 to 30 hours after resistance exercise. You have an improvement in mitochondrial density. One exercise bout, you're doing the right thing. When I have people in pain or they have delayed healing or they have issues and they do just one thing or two things different, they realize, I didn't know it could have such an impact so quickly. If it's done prudent and safe, yeah, it's pretty cool. If you have the right lifestyle factors, you bet. This one looks at the difference between their control condition was looking at, say, 10 reps of a squat. So imagine just doing 10 squats. And then the other group in the study did slow tension work. So the time under tension really skyrocketed. And they want to measure the mitochondrial difference between slow tension work to near fatigue and basic isotonic exercise of just doing something rhythmically but a little bit faster. So they want to look at the time under tension component to it, and it has an incredible difference in the mitochondrial hit to it. So what does that tell you? If someone can't move fast because they hurt or they're a little bit older or the tendon's a little more brittle, go slow. Slow tension work is good. It can definitely improve mitochondrial health quite a bit. So deeper into the role of aerobic health or mitochondrial health, if all of us race up the stairs really quick, okay, the energy system at play there is the phosphocreatine anaerobic system. And you'll probably remember that's not aerobic. That's the opposite of aerobic, right? So we don't really need aerobic health to do that, right? To do a quick little 1, 2, 3, 5-second pulse. Say, let's get real. I've got a knee pain patient that's post-operative. They're by 8 months later, and they're walking across the street, and all of a sudden someone speeds their way, and they got to run really quick across the street. Doesn't take aerobic health, does it? Well, what's critical, and I explain this to people who are interested in more aggressive exercise, is your aerobic health is what's feeding the substrates needed for repeat bouts of aggressive movement. So in other words, this PCR, the phosphocreatine energy system, which I'll share in a second, a few slides on that, is you need a strong aerobic health, i.e. mitochondrial density, to do repeat bouts of that. So with poor mitochondrial health, you might be able to race upstairs really quick, but you won't be able to do it again. You won't be able to recover from that. And so aerobic health, mitochondrial health, is critical in that recovery. And consequently, our regeneration from that stress. Now, I say this to clinicians because it's super critical. If someone's in pain, if you do safe and prudent exercise, it has a hypoalgesia effect, reduces their pain. Maybe not so critical at this part of the talk, but understanding that pain limits people from movement. So if you're the doctor and you're saying, hey, I want you to walk more, odds are if that person's overweight or they're a little bit aged, maybe they've had a surgery, maybe they've had some bad falls in their life, they can't do it because it hurts. So we have an issue that pain many times stops people from being more healthy, from changing their lifestyle. They get discouraged every time they try and do something and it hurts. So the mitochondrial health reduces, repairs, regenerates, helps you recover. Pretty big deal when it comes to adapting from any stress in your body that's physical. And the stuff that I teach to trainers and clinicians and working on kind of slow tension, we think of mitochondrial health, we think of heart health, we think of aerobic health as simply long, slow distance, long walking, cycling, easy stuff like that. Well, it's absolutely, I'm not going to say much more critical, but extremely critical at the muscular level in how we move. There's different types of muscles in our body. There's the slow tension stabilizers deep surrounding our joint centers. Think in your shoulder, in the small of your back. How many muscles do we have in the body? Anyone? 6, 7, 800? But people know the pecs, the quads, the lats, the traps. The big muscles can be said in less than, probably big muscles, 2 hands, 10 to 12 big muscles that everyone really knows. Calves, hamstrings. Why do we have so many small muscles? To stabilize and coordinate movement. They do that every day. They do that at all seconds of the day. Even right now, my big muscles aren't moving that much, but my slow stabilizers are doing their job. They need enhanced stamina to do that throughout the day. And so aerobic work is also critical for the aerobic stamina of your stabilizing tissue. Again, as a physical therapist, that's everything. Because if you, as a physician, asking them to move more, and they can't move more because they have poor stability in their foot, then their foot collapses, their knee hurts, their back starts to hurt, they're limited with their activity. So the stabilizing health of our body is everything for us to be able to handle repeat stress on it. And what does stress do? But it makes us resilient if applied in an acute fashion, a non-chronic way. So everything feeds, it's very cyclic here, and that's why I want you to start thinking about this as well. I wonder how well I can stand on one foot. And what happens when I'm standing on one foot? What am I doing? Is this a cerebral activity or is this stamina activity? Or a little bit of both. Okay, this is our continuum. I'm going to show kind of variations of this slide for the next probably like 15, 20 minutes here. But this is our continuum that we teach patients. And I think it's critical if you guys are going to go into a field of medicine to know this type of continuum, and it should exist for every person. Because the performance part of this continuum is, I want to be able to do this. I want to be able to hike Mount Tallac. I want to be able to run a 5K. I want to be able to do this activity with my grandkids. I want to be able to play this sport for my college. Everyone's interested in performance because that's life. That's what gives us purpose. And we need a path to show people how to get there. So, if we focus on how well we move, that is absolutely step one. But married to that is our strength. And strength at a simpler level is how well do we stabilize. And right now, I'm curious of the group of when's the last time you've tried a side plank? Or when's the last time you've tried to stand on one foot for 60 seconds? It's harder to do than you might think. But if you have good stabilizing health in your body, and you have good motion, then you can slowly control patterns. Think Tai Chi, think yoga. There's a reason why those are commonly preached, because done slow, they focus on both stability and motion. And if you keep the threat low, nearly everyone can accomplish some sort of success with it to improve slow control. So that's why it's early in our continuum. And why does strength matter? Grip strength has been tied to overall health. What do you think the normal grip strength of a person in the United States should be, normalized to their body weight? How much should you be able to hold in one hand? Anyone? Reference it in pounds or percent of your body weight. What do you think? Say something. Non-doctors, no doctors allowed. What should you be able to hold? Should you? Now, I didn't say at age 60 or at age 30. What should you be able to hold? Your body weight with one hand? I love it. That's two. We'll do two hands. Two hands body weight. With one grip, you should be half your body weight. In China, they could do 60% of their body weight with one hand. Notice I didn't say age. We should all be able to do that. And if you can't do that, we have a problem. That's an independent predictor of longevity and chronic disease. This is a common study that's been vocalized a lot in terms of the conferences I go to, because it's kind of a fun one. But I want you to test this when you go home today. I want you to sit on the floor and try and stand up without touching the ground with anything but your feet. Can you do it? If your knee or hand if you put your knee or your hand on the ground, you get 1 point subtracted from 5. So the goal is to be able, I'll show you right here. See if the camera can get me. So the goal is to be able to stand up without the use of your knees or your hands. And that's not a mobility trick, it's a predictor of your longevity. If you can't do that, we got a problem. And when I have patients that have had some injuries, say they're in their late 60s or 70s, and I get an idea that they're not moving too well, I ask them, when's the last time you've been on the ground? And then they look at me and they say, it's been a while. We have a problem. And further in our control is speed. Now speed, this is not, although Jenny set up very nicely by talking about sports medicine, this is not just sports. I just gave you the example of a woman trying to cross the street when a car is racing at her. Life demands speed, make no mistake. You absolutely need it. And if you can't run, we have a problem. If you can't swim, we have a problem. That's a life problem. It's a lack of resiliency with what our world can throw at us. So being able to control speed is absolutely critical. And we have training exercises that helps out with this. I have this type of research for the trainers that we impact. I told you how many patients we've interacted with in 2019, but what I feel really blessed with is how many trainers I influence. And as a doctor, that might be able to see, say, 2,000 visits in a year. But if she can influence me, and then I can influence the other clinicians, and then I can hold a course with a whole bunch of trainers, and then I can put people in gyms that help people to touch their toes so they can join a class of 20 and do a safe HIIT class for some, and maybe a safe mobility aerobic recovery class for others. Now, what's the impact of Dr. Burke? So scalability is absolutely huge. How do we affect millions with strong, great ideas and great methods? So deeper along our continuum is looking at power and performance, and this is fun. We talk about this a lot because, again, performance is life. Performance is purpose. People are excited about, I really want to be able to do this. I'm always amazed at how much training people will do on a simple level. I'm not talking about athletes. I'm talking about you. I'm talking about you. What do you want to accomplish this upcoming year? And it's fantastic when you start drawing a really strong purpose of what people are going to tie themselves to and how well they're going to work to get there. It's absolutely critical. But looking at the limiting factor is a big deal in all medicine, whether it's a clinical medicine like physical therapy, or in a GI specialty area, or if it's functional medicine, or if it's looking at hormonal health. What's the person in front of you's limiting factor? What's going to stop them first before anything else? And here's a few limiting factors. For motion, could be the health of the tissue. For strength, it could be the tissue size or your recruitment or how well you're able to tighten up. For speed and power, it definitely could be either, you can think of it as youthfulness or training history, but also the elasticity of our body. And then for performance, how well is our readiness? How well is our training program? So understanding limiting factors is absolutely critical. If any person in front of you you're trying to influence, what's the one thing that's going to allow them to move the needle forward? Going on to more of an energy system, so that was, I think, a big focus of why Jenny wanted me to come today and present to you, is understanding energy. So Eric spoke to you about the Krebs cycle a little bit, and kind of going back to some science. This is words that I use with clinicians and trainers alike. Systemic aerobic training, both in think of cycling and walking. That top one is long distance work where your heart rate is probably not too high, around maybe like 120, 125, 130, and we'll call that some LSD work. Varying intensity intervals has more to do with kind of that HIIT style. And you work hard, then you work lighter. Then you work hard, then you work lighter. And you'll see someone's heart rate kind of go up and down in some type of interval fashion. Local aerobic has to do with our stability through our shoulders or back, our hip or feet, in the areas that need stability focus. And the prime moving tissue would be how well you can control some slow pushing. Think walking up a hill, a really, really steep hill, and you feel your thighs burn. Or even doing, like I say, a slow push-up or holding something overhead for a little while. So we can focus on the aerobic health both systemically and locally at the tissue. Now the lower two have more to do with what we call lactic aerobic work. And you probably should know this if ever you want to impact patients, because they'll say, oh, I'm doing an aggressive boot camp class. Or they might say HIIT, or they might say interval training. And you need to know really the details about that to understand the stress of that person. And a lactic aerobic done well means that the average heart rate of the activity should be below a threshold or really close to your anaerobic threshold. Anaerobic threshold meaning the majority of that activity was aerobic. A lot of it was anaerobic, but your average heart rate was just shy of an aerobic threshold. And you'll find that people can do that for 20, 30, 40 minutes without an issue. If it becomes lactic, again, going back to alactic is without the presence of excessive lactate in the blood. That means your aerobic engine is so strong, you flush out the substrates, you flush out the byproducts. You're clearing the lactate from the blood quite regularly because you're resting enough. Lactic, what's lactic work? Who played a sport over the past week or two? Who played a sport? That's lactic work. Playing activity, skiing down the mountain slope, playing soccer, doing an aggressive activity becomes lactic because you're interested in the ball, you're interested in the mountain, you're pushing your body hard to a limit. It's fantastic, it's wonderful. We don't really need to train like that because life performance does that enough. I speak to this whenever people really want to do something aggressive. My knee hurts, my doctor wants to move more, I'm really interested in doing this thing with my kids in 6 months. Can I do it? Yeah, we can. But we got to build up to it. We got to do from the top down. We got to work on your long, slow duration work. We need to do some type of interval training. We need to work on how well your tissue braces and stabilizes. And then you can build up the ability of doing that aggressive thing, whether it's with your teammates or your kids or your parents or whatnot. So this is a continuum that we put together. And this is fun. This is my livelihood. This is what we teach, and this is what we preach. So the numbers from left to right stand for zones, 1, 2, 3, 4, 5. And we have conditioning on the top and movement on the bottom. And I want you to understand that when we ask people to move more, we have to understand stress. It is a game of stress. And appropriate and prudent stress are really key things. Appropriate meaning safe. Can the person accomplish this stress activity without hurting themselves more? The whole world's full of people who are trying to become healthier and they just hurt. It's sad. They go to the gym and they hurt. They do a running activity and they hurt. They join some league to be community-driven and be more active, and they hurt more from it. They're not being prudent and appropriate with it. So as PTs, our job is to help them steer. We need to develop the body to be able to handle the kind of stress you want to do. So we use this to help that. Going back to the energy systems, aerobic and anaerobic. Aerobic, think low submaximal work. Anaerobic, high maximal work. You don't need oxygen in the lower one. You need a lot of oxygen in the upper one. In reality, this is looking at it too simplistic. Life is always both. And it's critical to understand how they interplay. So we were taught this in science. You probably had some classes that already have this type of this chart. And you tend to think that a certain activity lives in a certain zone, right? Well, for sprinting, we're in the first 2 seconds. And if we're doing a marathon, we are in the far right area. And if we're playing soccer, we're somewhere in the middle. And the answer is wrong. You're always doing all of it. The stronger your aerobic system is, the better you can repeat bouts, as I said before. That marathon runner absolutely needs that strong anaerobic push, because they're going to sprint at some point in their run to try and beat out someone. And in reality, life, whether you escape from I literally had a patient just tell me the other day that she saw a big coyote, not a scrawny little coyote, like a really big coyote. So I'm not sure if she was just lying to me, but she ran away from the coyote. She got really scared by seeing this not mangy, like unfortunately healthy coyote up in Eldorado Hills. And so she ran away. She had a horrible knee for the past 3 years. And we had been working on her speed control so that she could run away aggressively. She needed both an aerobic system and an anaerobic system to accomplish that task. Now that was, I'm not sure if you'd say it's a life-saving event that she just did, but it's an important event for her safety. So when we think of exercise and we think of cellular health, when we think of mitochondrial density, it's a lot more than just you should exercise. It's a lot more than that. Because sometimes we think of exercise, and I might say this to a patient, and they might say, well, I'm not really that kind of person. I'm not really an exerciser. Like, are you a mover? Do you care to walk? What's an activity you enjoy? So the words are meaningful, and we need to make sure that we speak the language to patients that matters, because I'm not going to force all my patients to go to a gym, because many of them aren't. But I'm going to make sure that I speak their language to interact with them. So that's, I think, a key part to it. So in the science of movement and physical therapy, we talk about this a lot. So the image on the left is the skeleton. And for all skeletal health, for your health in your body, I want you to think of this and remember it forever, okay? We have an interplay of joint systems that has a tendency to either be sloppy or stiff. And that should tell us what we should be doing for different areas of our body. Our neck tends to be sloppy. We have injuries that are related to excess movement that pinch on the disc, that pinch on the facet joint, that pinch on the nerve. We need improvement in stability through our neck to correct these issues. The thoracic area tends to get stiff. The ribs come into the thoracic spine and creates a world of unfortunate stiffness to protect our organs. Our role is to mobilize this area. I'm amazed how many people with neck pain, if you do just one thing, improve someone's thoracic mobility, it gets rid of a large part of neck issues. Disc issues, nerve issues, pain issues, doesn't really matter. You improve someone's thoracic mobility, their neck is already healthier. You go one step lower. You have half the body up top, half the body down low. You have a column of 5 vertebrae in the middle. Doesn't look very stable when you look at the skeleton like that, does it? Can you see how that's probably the weakest part of the human body? So what do we need in the lower area? We need stability. The back does not thrive with a lot of movement. In fact, excessive movement, particularly in one direction, leads to the majority of dysfunctions. If any of you have had any back pain, this applies to you. If you improve thoracic mobility up top, and you improve hip mobility down below, and learn how to brace a little stronger through your midsection, you will probably take the first step to improving your back. And this is a big deal. This is probably our whole culture, where the studies show 80% of people have debilitating back pain at some point in their life. Debilitating meaning they can't get out of bed. That's kind of a big deal. And it's a really big deal when we're trying to motivate people to live a healthier life. Because most of the people I interact with will say this: you know, I was doing so well. I was walking every day. I was working on my Pilates or my yoga. I was eating healthier, and then my back went out. And once my back went out, I couldn't get out of bed. I started not eating as well. I started getting depressed. It's a cyclic, vicious cycle. Pain does that. It leads a massive vicious cycle to poor lifestyle factors. Everything kind of feeds on itself. And you take away someone's community, you take away their zealous nature, you take away their goals, you destroy their mindset, it goes downhill pretty fast. So it's a big deal from a clinical standpoint to appreciate the roles of our skeleton to improve the skeletal health. Now, the images on the right have to do with fascial lines. And this is my life and our culture, but we have plenty of people here that can't touch their toes. Now, we're in a tough environment. Usually I have everyone stand up and see who can't touch their toes. But most people will say, oh, my hamstrings are just too tight. That is so rarely the case. It's just not. It's not. I was a part of a conference with one of my gurus. His name is Greg Cook. And he challenged about 300 people in the room that were all clinicians. He says, all right, gang, let's talk about the toe touch. Who can't touch their toes? And about maybe 50 people raised their hand of 300. And he goes, oh, this is going to be fun. Who thinks that their hamstrings and Achilles tendon are just too darn tight and they'll never be able to touch their toes? And 10 people were still raising their hand. He goes, great. Out of you 10 people, I want to know who hasn't been able to do it in the past 10 years. 3 people were raising their hand. He goes, great. I want to know which one of those 3 thinks it's absolutely impossible to touch your toes with your legs straight. One was still holding his hand. He goes, you are going to touch your toes today. He had that much confidence to do that. And over the course of 20 minutes, he had this guy do a series of stretches, neuromuscular drills, balance activity. Sure enough, after 20 minutes, he touched his toes. He was a clinician. He was in medicine, supposed to help people how to move better. That's crazy to me. He wasn't just talking to lay people in the biz. So understanding fascial integrity is a big part. This is why we work on people's tissue. This is why we do motor control drills. But it's critical for all patients. They need to be able to move well if they're going to move often. That's a line from Greg Cook. Move well first, then move often. We want them to move often for cellular health, for mitochondrial upregulation, for better community. See how everything kind of feeds into one another? It really all comes back to, are you moving? Did you move today? So here's quite a few of our tests. I'm going to skip over these because you guys probably care a lot about this, but we don't have the capacity to actually do these drills. So we have a test for the shoulder. We have a test for the hip, knee, and ankle. We have tests for the spine. These are all low-level motion tests that we really have success with accomplishing most of these, passing these tests within the first few weeks of any rehab that we do with patients, regardless of age. We do this with every age. Yeah, if you're in your 70s and 80s, our expectation is a little lower, but we do with everyone. And then we have dynamic control movements for the spine, dynamic control for extension there. And as Jenny hinted, I'm a kettlebell instructor, so I love talk on reactive stability, and this is a research article on looking at the ability to stabilize is predicated on our ability to control movement. Those are 2 competing factors. So that means the ability of doing a plank is probably first and foremost predicated on how well you can control movement through your spine. Those are different. How well can you control movement? How well can you brace? The 2 tests we look at are how well can you roll? Can you roll on the ground in a smooth, coordinated fashion? And then can you control a single arm front plank for, say, 20, 30 seconds? One feeds the other. If you can't control movement, you have a poor ability to co-contract. And we have other speed. Like I said, I'm a kettlebell instructor, so I love Turkish get-ups. If you guys have never done a Turkish get-up, find someone who can teach you. Don't learn online. Jenny knows how, if you want to ask Jenny. And these are other stability tests that we look at, and we time it. This is time under tension work. Can you do this for 60 seconds? We make everyone do this for 60 seconds. We make everyone pass these drills for 60 seconds. It's not about Pilates is best. Pass the test. So we talk about this with patients all the time. We use the continuum to help them navigate where are they at? How are they going to accomplish their goal? Where are they going? Let's put the test together. Let's put the training plan together to accomplish your goal. That's what we use. We use this continuum to teach people and empower people. This is where you're at. This is where we're going. And then we use the pyramid to have them understand that your lifestyle factors are extremely important. They might even be a 10 times multiplier, where the type of running shoe is a one-time multiplier. Your training program online that you picked is a one-time multiplier. Did you sleep 7 plus 8 hours? That's a 10 times multiplier. So we love speaking this because everyone needs that accountability coach. They just do. We do better with it. Whether it's our loved one, whether it's our friend, or whether it's our exercise coach. So early in my academic career, learned a lot about myelin, learned a lot about muscle, length, force, velocity. And it's still important today. And I teach clinicians this, and I know they probably got a glimpse of it in their academic studies, and I make it real. Okay, the image on the left is myelin. Just like mitochondria, we can up and down regulate this substance in our body. How our CNS affects our whole body can be good or bad, largely depend on how much you practice. If you practice, that conduction signal gets better. If you do something in a healthy way over and over, you get better at it, right? It happens relatively slower in terms of the physiological adaptations, but it's so critical. The image on the right is the force length curve. The force length curve is the reason why many people can do a medium level squat, but few people can squat all the way down and be fine, or to be safe with a control. It's hard because as the muscle gets long or gets short, we have active insufficiency, we have a force problem and deep in the sarcomere level. And because of that, most of us are not strong through the full range of motion. This is why it's hard to touch your toes. It's why it's hard to pick up a box. It's hard to transfer a loved one when they're lying in bed sick. It's hard to do life if we haven't trained through the movement. And if you have poor movement health, you will hurt, regardless of how strong you are. Because if you're not strong, when the tissue is really short and really long, that's where life exposes you, and then you have the vicious cycle. Then you hurt, your neck gets kinked, you pinch your nerve, your sciatica worsens, you get depressed, you start eating unhealthy. You see how it keeps feeding into itself. So this is critical for the health of our mind and the health of our life. And this is why our therapy practices exist in gyms, because there's a lot of green space, a lot of turf space. Everyone's on the floor rolling around and working on how well they touch their toes, and then working on a stability hold, and then they do some resistance training. Because it's not about which exercise method is best, it's about filling the bucket. And these buckets, we have these continuums to appreciate limiting factors, trying to understand how to influence the person in front of us. And so we use this for our trainers to understand if the person looks like this, if they're an adult fitness person, they want weight loss goals, they want better muscle tone, they're rehabbing from an injury, live in zone 1, zone 2. Don't do soccer. Don't join a rugby group. If you're rehabbing or if you're trying to lose some weight, start with zone 1, zone 2. Go for a walk, do some easy intervals, work on some plank holds, and some light, appropriate resistance training. If you're a little more aggressive, say you can touch your toes, say you can bend backwards, say you have some improving movement health, we get a little more clever. We can do some jumping jacks and burpees. We can work on some hill runs, maybe not hill sprints yet, but we're developing here. And if we have some athletes that are either youth athletes or adult athletes, we can really kind of take this, sky's the limit, and how far we can take this continuum. Okay? And this is our training templates that we use to help, in anyone's training, if they're doing something for your physical health, what do I do? Do I go on a treadmill? Do I hop on a bike? Do I do some squats? What should I do? So we help formulate what this training program looks like, and we do this for everyone Every single person, every age, you're going to do a little personal health session. What are you going to focus on right now? So I feel blessed to be part of this. I feel blessed to be offered this with our fabulous physicians here that are talking about this health. And I think of this as it does take a village. It does take a community. And depending on where you're going in your career, or for the presenters here, we all need the ability of extending our reach. I extend my reach through clinicians and trainers. Hopefully you envision yourself as extending your reach past just one patient in front of you, but seeing how well you can spread the message. Okay? That's it. Thank you.